How many of you pain warriors out there in pain management have to commute a long way to your doctor or clinic every month? I have to take a 45-minute Uber, and I know I'm lucky. A lot of y'all will have to go much further. So let me know in the comments what your commute is like. I've heard of people out west having to drive for hours, which is nuts. Now, the reason I bring it up, RFK putting his foot in his mouth on X again, here's the quote: access to quality care shouldn't depend on your zip code. No, it shouldn't, Mr. Secretary, but it often does. This kind of just made me mad. There are countless pain patients all over the country with very restricted access to pain management, as this U.S. Pain Foundation article is talking about. Healthcare deserts, lack of access has far-reaching consequences. Yes, it does. They're talking about all the logistics and hurdles that people have to jump through when they have to make these long trips just to access pain relief. And then you have the others with no access at all. They then make a decision. Do I suffer or do I use a very dangerous black market? And they shouldn't have to do either one of those, y'all. And then last, the U.S. Pain Foundation, a pain crisis, this is a study they did. 77% said that prescriptions were the most helpful modality for them. 47% were on opioids, and 3/4 of them said they faced consistent barriers to getting their pain medications. Of course they did. And then 94%, this is really interesting, blamed the CDC for those barriers. They're very nearly on point. The CDC created the guidelines, and then the DEA created federal regulation with the force of law out of those guidelines. Then the states created state laws with the force of law out of those guidelines. But the guidelines themselves, no regulatory force of law at all. They are guidelines, which your doctor will quickly point out in some situations.